Hi, I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. Today's video blog will answer this question. How long should I leave a pessary in place? How long should you leave a pessary in place between cleanings? There is no single correct answer. Some women wear a pessary only occasionally or wear it during the day but take it out every night. At the other extreme, some women leave a pessary in place for weeks or months. Pessaries are designed to stay in place for weeks on end, allowing fluids to flow around them, even your menstrual flow, but frequent removal and reinsertion is perfectly safe and acceptable. The good news is that you have options, and you can work with your healthcare provider to create a pessary care plan that works for you. What is a pessary? A pessary is a silicone device that you can wear at the top of your vagina to hold your pelvic organs in place. If you have pelvic organ prolapse, like bladder prolapse or cystocele, rectal prolapse or rectocele, or a prolapsed uterus, a pessary can allow you to be active and comfortable without the pain and danger of surgery. If you have urinary incontinence, some pessary styles can help you get control. Some questions to consider about how long to leave a pessary in place have to do with your individual preferences. How long do you want to wear your pessary? It's a matter of personal preference. Do you want your pessary to be only for especially active days or for every day? If you wear your pessary only occasionally, just clean it and store it between uses. If you want to wear your pessary every day, you have the option to remove and clean it daily, or every few days, or weekly, or only when you feel the need to do so. You can leave it in place the rest of the time, except at your gynecological visits for pessary care. And it doesn't have to be your gynecologist, by the way. It could be a midwife or primary care doctor can often do pessary care as well. Another question that's different for different women. Does your pessary interfere with sex? If you're sexually active, you can probably have sex, yes, including intercourse, with your pessary in place. Some pessary shapes will not allow this, but most of them will. Another question, can you remove and insert your pessary on your own? Some women don't have the strength or the flexibility in their hands to insert and remove a pessary, especially as they get older. Also, certain pessary shapes may be difficult for you to remove on your own. In that case, it's perfectly okay to leave it in place 100% of the time between appointments with your healthcare provider. Then there's, what do healthcare providers recommend? Healthcare providers will have different recommendations based on the way they were trained and on their own observations. Ideally, your healthcare provider will use scientific evidence to guide your care. However, regarding the question of the ideal length of time to leave a pessary in place between cleanings, there is no scientific evidence. No one has conducted a scientific study on this topic. There's no study I can find anyway. If you know of one, please contact me. No matter how often you remove and clean your pessary at home, it's important to have regular office visits with your healthcare provider so that they can examine your vaginal lining. If you don't remove your pessary yourself, but you leave it in place except at healthcare appointments, those appointments are especially important. Your pessary has to be removed and cleaned at least as often as every few months. Some providers want women to come to the office every month for pessary care. Others recommend an office visit every 3 months. I've even heard of one doctor who told one of my Kegel Queen members to leave her pessary in place and visit his office every 5 months. That length of time, by the way, is way outside my comfort zone, and it's far longer than most practitioners recommend. What about Pessary Manufacturers. What do they recommend? So here are recommendations from two leading pessary manufacturers, Milex and Biotech. Biotech recommends daily cleaning, but also says that it's fine to leave the pessary in place for 4 to 12 weeks. Milex doesn't address home care, but they recommend a follow-up visit with your healthcare provider every 4 to 6 weeks, noting that the schedule can be adjusted based on patient and physician preference. So, how often should you remove and clean your pessary after all? It's up to you. You can remove and clean your pessary every day, or you can leave it in place as long as 3 months. Any pessary care schedule within those parameters can work well, as long as it works for you with the support of your healthcare provider. To get more women's health information that could change your life, click the link below and I'll see you there.